So I will call this meeting to order, and please note that Mr. Clendenning is in the auditorium, and I think everybody else is virtually. Oh, Ruben is there somewhere, isn't he, Bill? Oh, there he is. Hey, Ruben. Okay.
He's just 6 feet over.
Oh, okay. That's good. And then Kathy, you can see who all is here, so that's great. So I will declare that we have a quorum present. Are there any members of the public that would like to make any public comment?
Yes, Madam Chair, I would, Bill Clendenning.
Yes, speak.
Okay, so one of the things the only thing I want to talk about is I signed up to get the shot on the internet and an email, and when I got my answer back, I was surprised to see the heading. You know what I mean? I just thought it was a scam or something. But anyways, I tuned into it and it said that, thank you, we've accepted it. And then we will call you when there's an appointment. So I think it's when we'll call you when there's an appointment. So I did call there and it took some time, but they even said the same thing when I got a hold of that last number that I had to do. That was even on Channel 7. And I called that and it said the same thing. So does that mean that it was in Wisconsin Rapids today, I believe, the 28th? Yeah.
No, I think you were at the firehouse today, weren't you, Sue?
We were in Marshfield yesterday and we were in Rapids today, but both
Right.
clinics were completely full.
So would that have been a health department website he went on, Sue?
If it was on our website, then yep, there's a form on our website. I'll show you guys later under the COVID update.
Okay.
There's a form.
Yes,
Okay,
so Bill, maybe that question will be answered as we move through the agenda,
I'll just
okay?
wait for that.
Okay, all right.
I ordered donuts.
Okay. Okay. So the next, if there are no other comments, the next item on the agenda is the consent agenda, which includes the meeting from December 15th, and that wasn't on there, but it's in the packet. So we'll do the 15th and the 17th. And then Kathy, I assume the January 19th minutes will be in the next packet. Because we had a meeting January the 19th before county board.
Madam Chairman, this is Tom. I make a motion to approve the consent agenda.
Okay, I have one question. Kathy, I just assume the January 19 meeting will be. Okay, I'd like to pull page 12 just because I have a question about page 12 and not specific about page 12, but about the P cards for the other departments. So I have a motion to approve the consent agenda. Is there a second?
I will second, Laura.
Okay, so Laura seconded. Now I will ask, does anybody else have anything else other than page 12 that they want to pull from the consent agenda? Okay, hearing none, then we have a motion to approve the rest of the consent agenda, and all in favor signify by saying aye.
Aye.
Opposed, like sign. Does everybody want to unmute and just say aye?
Aye.
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 Very good, thank you, and aye. So any opposed? Okay, hearing none, then the motion carries. The question I have about page 12, and I've got two screens here, so I have to look back and forth. Page 12 is the P card from the health department. So I was wondering why we are requesting that P card from just the health department, and what does the committee think about having all the P card charges from all the departments to be consistent about what they're charging to the P card, or just eliminating getting that P card? Because see, we used to get the credit card we used to get the credit card, and now that we've gone to the P card, all the departments are having a P card that they use. just thought it was a little strange to only have that department, and I was looking for input from the committee to see, do you want to see everybody's P card charges in the month, or do you want to see any of them?
Donna, are those included in the vouchers then later also, or is that completely separate?
They will be somewhere in the vouchers, okay? Because their charges, their departmental charges, and they're just using a P card to have one charge card that they're using with things that require charge card. So they would be in there. Is that not correct, Kathy? You would see them somewhere in the vouchers.
You would see the one full payment in the vouchers, not the detail of what makes up that P card charge.
Okay. Okay. So you would see that you made a payment to the P card. Okay, without the details.
Donna?
Yeah.
Brock, on the vouchers, it'll say the vendor name will be US Bank.
Yes.
And in my department's case, if I have more than one charge on there, I would put a P card statement in. But as in this month's, it says US Bank and it says cemetery flags because I don't do the volume that the rest of the departments do.
Right.
So if I have multiple items other than just one charge, I will include a P card statement.
And therein lies my dismay. Why are we getting it from the health department and not getting the P card statement from Human Services or Edgewater or Norwood? Jordan, you have an opinion?
Donna, this is Marissa.
Yeah.
Hi. Edgewater's credit card activity is on page 23.
Okay. Is that the only other one that's on there?
No, I believe Norwood and Human Services, the community side, have their activity report on there as well.
Okay, well, I just missed that because I don't have two screens to look at the vouchers and everything, and I must have just missed that. Okay, so as far as what you're telling me then is all the P card statements are in there. I just missed them. Okay, I'm happy then. Okay, so Kathy, you can just say that some questions were asked about P card statements and it was answered, so we're fine, okay? I guess we need to approve page 12 since I pulled it out. So I will make a motion to approve page 12 of the consent agenda. Is there a second?
Laura will second.
Okay, Laura seconds it. If there are no other questions, all in favor of the motion signify by saying aye.
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 Opposed, like sign, and hearing none, the motion passes. Okay, then on page 63 through 67, the financial statements from Edgewater Haven, Human Services, and Norwood Health Center are there. Did anybody have anything that they wanted to ask a question about? Joe, did you have any updates on those financial statements?
No, not at this time. We're still working through year end. There will be some adjustments. There always are at year end, but we don't know the extent of those yet.
You try to close 2020 in your department by when?
Well, by the end of February, but we always have things that continue on into March because the state aids aren't all finalized yet. And we do have the deferred revenue that we have to calculate, which I can't do until March because we have to wait out the 60 days of receipts. So the bulk of it is by the end of February, but there are still some adjustments that occur into March. And those state aids keep filtering in, so that can change even sometimes as late as April. But
all right, so if there are no questions about that financial statement, the quarterly reports for the Health Department and Veteran Services are on page 68 and 69. Kathy, did you have any updates on that quarterly report?
Only that we still have some additional CARES funding coming in, COVID CARES funding. And so our tax levy that shows at 1.3 million will be closer to 930,000. which means that's super good because it means we're turning back over 550,000 to the county. Thanks to the CARES Act, or I mean the CARES funding.
Well, yeah, they're just printing the money, so don't jump up and down all about that. Adding to the debt. Okay, Rock, you do a good job of saying what you want to say on your quarterly report, so it looks like you're in good shape. So Norwood and Edgewater update on provider relief funds. Jordan, you want to go first?
Sure, I can go. And just to follow up on, I just looked through our vouchers and I saw that our US Bank card doesn't have the detail listed there for Norwood. Certainly I do get that every month, but I'm not sure of the best way to present that to you guys, but I can certainly work with Jill if you guys would like the detail on that.
Well, I think it's consistent to get the detail across departments. And maybe you could take a look at what Kathy does in her P card reporting on page 12 and try to mimic that report and see if you could put it in the same format for consistency.
Will do. So I made a note on that. So thank you. As far as an update, I'll try and be brief on the COVID PRF funding. We're scheduled to do our initial reporting into the Provider Relief Fund portal on January 15th, and that was supposed to go through February 15th through the first reporting period, which was, I believe, March 18th through the end of 2020. That has been delayed with no date set yet on when that initial reporting will begin or when the deadline will be. So we are still kind of waiting on that to be communicated, but we are both Edgewater and Norwood continue to work with Whipley on filling out our provider relief workbook. And that details out all of our expenses, our wages, etc. So everything that we can capture and pay for with the provider relief funds we are, which again, in turn, similar to the health department, should help save some funding that we would have normally spent out of our operational budget. And so hopefully at the end of the year, that will be more money available back to the county. But a couple of big ticket items that just giving you guys an update on, giving the committee an update on, we have installed all touchless light switches throughout the facility. We continue to work on some odds and ends areas, but that's to reduce touch points. Same thing with all of our touchless faucets and flush valves. Those have been replaced. So I know Lee and his team have worked very hard in getting a lot of this stuff completed. We received some of our outdoor furniture delivery this week, so that will be helpful come the spring for visitation. We've received smart vital machines and scales that talk to our electronic medical records, so our staff don't have to go back in after they're done weighing individuals and enter that into the medical records, so that saves them time. We've purchased some screening machines that are at the entrances of our facility. Those are AccuShield machines, so those have a set of questions you respond to. It takes your temperature, and then we get alerted immediately if anybody has any symptoms or anything. They answer yes to a question. It will not print out a paper sticker for them. And then all of our staff and visitors that come into our building will have a paper sticker after they've successfully screened into the facility. So that's just another tool that we've used to help ensure that everybody is screened prior to entering the facility. And it also keeps track of everybody who comes in the facility for us as well. In addition to that, we've also purchased and received electrostatic sprayers and UVC light towers. So that certainly helps us provide a cleaner environment and clean our facility a lot quicker. We have started with the software for mass communication to similar to Edgewater. We're using the system that IT has set out and used for the county called Informacast. So we're able to reach out to our staff and family members very quickly and easily versus picking up the phone and making 100 different phone calls. So that's been helpful. We're still waiting for laptops to come in that we've ordered from our IT department. We have received iPads for residents to be able to use and communicate with their family members. We've installed CO2 and humidity sensors in our HVAC system. IT just completed installing AC units to our equipment rooms that house our electronics, so like our Wi-Fi system. As we are embarking on expanding our Wi-Fi system, when our Wi-Fi system was put in, I think several years ago, back in 2006, if I'm not mistaken, we certainly didn't anticipate the growth that we've had or the reliance that we have on our Wi-Fi, especially now with doing telehealth and virtual visits, all of these devices that we're adding on. And so we're really getting upgraded on our wireless so that our system can handle all of this bandwidth. And so to keep all of our equipment cool, we needed to add AC to those equipment rooms. So that's been completed. We are close to getting that approval for the Wi-Fi improvements, but it is a pretty significant investment. It's over $300,000 for both Edgewater and Norwood. So again, the fact that we're able to get this accomplished using provider relief funds versus capital funds from the county, that's just a huge benefit for Wood County. In addition, we had some walkthroughs with our engineer as we worked to convert the canteen in the front lobby into a meeting space for families and residents, and that project should be continuing to move forward. In addition to that, we've again spent a lot of time trying to track and identify labor costs associated with COVID and get those captured so we can get that reimbursed. And so again, all of those things are at Norwood, but several of those things we are sharing and trying to duplicate over at Edgewater. So again, we can maximize the use of the $3.6-ish million that we've received from provider relief funds. So again, we're certainly some things in the works. We're looking at replacing our tubs. Our tubs are certainly old and outdated, but again, if we can tie that to a COVID-related expense, we can certainly look at getting those replaced with the COVID funds, again, saving us. Those were scheduled to be replaced with some capital projects, but again, if we can save the money on the capital projects, we can turn that money back or use it on other like projects. But again, we're just trying to be as fiscally responsible with the funds that we've been given, and certainly try and use the funds that we've been allocated so we don't have to turn those back. But again, making sure that they're justified and allowable expenses. So that's pretty much where the majority of our time's been. In addition to, I know we, another big thing to mention with these provider relief funds is we have really gone out of our way to try and assist the health department with becoming a vaccinator clinic, a vaccinator site. I know we did about 109 vaccinations on Tuesday. We did another 100 plus vaccinations today for the community. So again, Mr. Clendenning and anybody else on the call, if you would like, we can certainly try and get you accommodated with getting a vaccination. So please reach out to myself or Liz Massans, our Director of Nursing. We are trying to do community vaccinations every Tuesday and Thursday based on the allocation that we receive, which again, we're trying to do as best we can, as many as we can, to try and help out Sue and her team. And so that's where a lot of our time is going as well. So that's our update with the COVID funding and how we're using the funds and where we're currently sitting.
So Jordan, are you getting your own allocated vaccine, or are you having to get vaccine from what Sue gets?
No, we are receiving our own. It started, I believe, last week we received 60, and we did a lot of the community folks, or actually, yeah, was it 60 last week, I think, and we did the community folks for their vaccine of human services. This week on Tuesday, I know we started with the fire and police force and funeral directors. I know we're working on dental clinics. Teachers is another big task for us. And two, we've kind of opened it up to those individuals 65 and older. So yeah, we're basically taking names and as many of the vaccines that we can, we're trying to get people scheduled. And I think we have a pretty good system in place here. And again, it's just a benefit to be able to help out our community and able to do that.
So you're not necessarily sticking to the phase 1A and phase 1B list. You're just, if you've got vaccine, you're giving it.
We're certainly trying to, but again, in order to avoid wasting any vaccines, we are, yeah, I mean, we've pretty much, we've gone through all the 1A folks that are at our facility and within our organization. So again, we're trying to work down that list of the 1B group. I know the teachers being in that group, that's going to be a big undertaking as well. So again, we're trying to work on that. But again, we only got, and I say only, but it's a lot. We got 200 vaccines allocated this week. We're going to try again next week for 200. I think Sue tried to get about 700 and only received about 400. So again, I know they're rationing the vaccinations that they're giving out, but we're still going to continue to try and request as much as we can.
Marissa, do you have anything to add to that, or are there some duplicative efforts that you're doing over there? You need to unmute. Yeah, there you go.
Sorry, my control bar went away. I was trying to find it. So we actually just finished enrolling as a vaccinator. So our staff have to get trained. There's X amount of videos that they have to go through before that. And that's basically so we can vaccinate any new staff that we would have or residents that will not be covered under our partnership with Walgreens. And we also are waiting on our vaccine refrigerator that we ordered, but we definitely hope to help out as well when we have that all in place.
So are you all getting the Pfizer vaccine or the Moderna vaccine?
We got the Moderna at Edgewater.
Okay. So that doesn't require the cold storage that the Pfizer does, so you're in better shape with that one. Okay. Moderna. Okay. All right. Any questions on the use of these provider relief funds from any of the committee members? Good job, you two. I appreciate it. Marissa, I was going to ask you, are you trying to set up your chapel in a way that you can use that space for family visitation like they're doing with that canteen spot at Norwood?
Yes. Yep. So we have our chapel, and then we also have what we call our family room in our lobby, which is really set up like we have small table and chairs for kids and books and stuff like that. So we have been allowing some compassion visits. So, you know, if a resident really needs to see their family, we test them and use those spaces. If our county positivity rate continues to remain under 10% and we go 14 days without having a case, we will be able to do visitation in there, you know, in any instance if someone's going to consent to a rapid test.
Very good.
Donna, I would like to ask a question.
Yeah, go ahead, Bill.
So if you get your first shot someplace, do you have to get your second shot at the same place?
You're supposed to. That's the guidance. We encourage people to go back to the same place. In fact, we're trying to make the second appointment at the time they're there to get their first shot. it really should at least be the same brand of vaccine. So if you're switching sites, that could complicate things. If you got Moderna and then you go to a different place and they have Pfizer, you really should not do that. So it is encouraged to do it at the same place that you get your first shot.
And at Norwood, we are trying to take that into consideration because, again, we're only allocated a certain amount. We need to make sure that we have enough for the second dose of those individuals, and they're returning. And Supervisor Clendenning, same thing as if a resident or an employee were no longer with us. We would hope that they would at least come back and get that second vaccine from us because, again, we're getting allocated that vaccine typically.
Thanks.
And I mentioned, I think before the meeting started that Johnson & Johnson is coming out with a vaccine that only requires one injection. So I think that'll make things a little bit easier if they get approved in the next 4 to 6 weeks, along with 2 other vaccines to help increase the supply, which then we can start using. So I don't think that you all know this because I don't think I've seen you, but I think all of you know that I flew to Virginia in August to place my mother in a nursing home. She died 2 weeks ago after getting COVID in her nursing home. They had everybody in their nursing home but 2 residents test positive for COVID, and about 19 of those residents died. So my mother didn't die right after being diagnosed with COVID. She died about 34 days later, but there's no doubt that the COVID zapped her enough at the age of 91 that she did not fare very well after that diagnosis, and they ended up putting respiratory depression on her death certificate secondary to COVID. So yeah, so it touched home, but you know, she was so ready to go, and she'd been begging for 2 years for Jesus to take her. And so in the last year we said, we're going to pray for it too, because you really are miserable on this side of heaven. So yeah, so she probably is a statistic now, as are many people in her nursing home that she was in. So let's move to agenda item number 8, COVID update. Sue?
Okay, I made a list of things as things came up since I wrote my narrative. We have to write those so far ahead of time. There's a lot of things that happen between when I do the narrative and we actually meet. So I do want to thank Norwood, Jordan, Liz has been great to work with. And as you guys get vaccines, she'll email me like, what group should I work on? And I'll send her something and she just ticks away at it. And it's super, super helpful. So thank you for that. We did get some information this week that there might be an enduring vaccination site in Marathon County, probably in the Wausau area. They would hope to do 1,000 vaccinations a day, 5 to 6 days a week. We aren't sure about that or the location or anything at this point, and it's going to take some time to stand that up. It'll probably be more like late February before that occurs, but I did want to mention that. We are doing a clinic every Wednesday in Marshfield at the fire department. We have 2 drive-through lanes there where we can get a couple hundred people through in the day. And then every Thursday in Wisconsin Rapids at the airport hangar, we have 3 drive-through lanes there, and that's working very well. We get about 300 through a day there. Yesterday was our first Marshfield clinic. Today was our second Rapids clinic, and both of them were completely full. And it feels like as we go through, we can probably schedule more people in than we are. We just wanted to get a feel for how the traffic was going to flow and make sure we didn't have any bottlenecks and things before we really kind of reached for the stars.
Sue?
Yep.
My wife and I had the vaccine yesterday at the fire station, and it went very well, and staff was very efficient and friendly. So great job.
Good. That's good to hear. I'm glad to hear it. It sounded like it started maybe a little rough yesterday, but then things got back on track and they smoothed the wrinkles out pretty quick. We do have a form on our website. I'm going to share my screen so I can show you what that looks like, and this might enter or answer some of Supervisor Clendenning's questions. Hopefully this is going to come. Oh, that's not it. Sorry. Oh, here we go. All right. So if you go to, this should pop up in a sec. Hopefully, can you guys see that? Yeah.
Yes.
So if you go to the main Wood County homepage here, click on this yellow banner. That'll take you specifically to the COVID information, and go down to vaccination information. And this big blue bar here is a form that you can fill out if you're interested in receiving the vaccine. There's also a phone number that you can call. This is going to go into voicemail, but we do have, I think, 3 people checking that voicemail regularly. This is a super cumbersome process right now, and it's going to change the second week in February, but this is all we have to work with at the moment. So people fill out this form, it goes into an email box, and then we have staff reaching out to people who fill out the form to schedule their appointments. So as our clinics fill up, we obviously just stop calling people because we don't have any more appointments. So that's the way it's working. We're getting a ton of these forms in, and we can't get all the people in who are interested in the vaccine. The demand is way, way greater than the supply at this point.
That's good.
But this option is there. When we get into the second week in February, we are supposed to be one of the pilot sites for a DHS registration software system that will come out. So people will be able to go online, and there will be a calendar with all of our clinic dates and times, and people can sign themselves up for a time, which will help tremendously with our staff capacity. But until then, we're kind of stuck with this system. But it's been working. We've been scheduling appointments and getting people in. So this site also has the different phases and things. I'll show you a DHS site that is even more detailed, but I just want to let you know that this is here.
Sue, this is Laura. Do you mind if I ask a question quickly?
Sure.
So was it last week that it got opened up to 1A was opened up to ages 65 and older?
Yeah.
So do you anticipate that being a problem or really lengthening the amount of time it takes to get to 1B then?
It is going to lengthen that time. So there are 700,000 people in Wisconsin who are 65 and older, and our state is getting 70,000 doses a week. So that is 10 weeks right there to get through that population. So it's going to take a long time. Unfortunately, the vaccine is just trickling in, and we have the capacity to do more, but we don't have the vaccine, and it's pretty frustrating.
Yeah, sure. So as far as like teachers and educators, they're likely not going to get it until kind of near the end of the school year then, right? Or
we're hoping for March, but we'll see. We'll see. Tentatively March 1st, they'll be eligible, but we'll see how things actually play out. If we get more vaccine, we might be able to meet that deadline and open it up, but if we don't, we won't.
Sure. Okay, just curious. Thank you.
Yeah, no problem. Our health systems obviously are also vaccinating folks 65 and older as well. And Marshfield Clinic posted information about how people can sign up, and they had 27,000 phone calls in 2 days. So there's a huge demand. A number of our pharmacies are also approved vaccinators. So there's a group, there's a pretty good group of us trying to chip away at this together. It's just the kind of the vaccine supply issue. Clicking through my notes here. So this website here, this is the DHS website. And if you Google Wisconsin DHS vaccine, then there's a spot you can click, am I eligible? This is a really good spot to keep an eye on who is currently eligible to receive the vaccine. So these are the people we're working on right now. The next eligible groups are tentatively slated for March 1st, but then there's some good breakdown here below that of who are the next eligible groups. So more detail around educators and childcare and who that is specifically. Public facing essential workers, who does that include? There's a lot of pretty good detail in the site. So I just wanted to point that out to you guys as well. Let's see, I'm getting through my list pretty good. There is also, let's see, I'm going to go over to vaccine. There's some pretty good vaccine data on this website as well. So if you just again Google DHS Wisconsin vaccine, it'll take you to this page. And if you go to vaccination data, if you're curious how many people by county have received the vaccine, you can scroll down and you'll, I do live in Necedah, so my Wi-Fi is a little pokey. I just want to show you where we can look at county level. Whoops. All right, so right here you can click on this, Wisconsin, and scroll all the way down and hit Wood County, and then you can see by date how many people were vaccinated with both the Moderna vaccine and the Pfizer vaccine. And there's a bunch more data here too. So if you're curious how the vaccine is rolling out specifically in Wood County, what kind of numbers we're looking at, this is a good site to check out. I'm gonna stop.
So
Yeah.
stop at this screen a minute, because
Okay.
I want to point out to you this allocated amount here. Where is that screen?
Here, it's
Yeah.
up here.
Yeah, right here. So this is vaccine distribution summary. This right here through the Pharmacy Partnership Program, which is the CVS and Walgreens, this is how many allocated vaccines they are able to receive from the federal government. And this is how many have been ordered. So there's a big push in Madison to get the DHS to order all the vaccines that have been allocated. And so that's one way that we're hopefully going to get more vaccines into Wisconsin.
Great points, Donna. Speaking of allocations and ordering, I did hear today that so all of us vaccinators every week, we put in a request to Wisconsin DHS for the vaccine that we would like, the number of doses. We have to do that by the end of the day on Tuesday each week. And then on Friday, they will let us know what we're actually getting. And then we usually receive that on Monday or Tuesday. So I was on a health officer call today. We have a daily call, and they said that the amount of vaccine that was requested is way greater than what Wisconsin received, more so this week than ever. In fact, Wisconsin's getting only 27% of the actual doses that were requested. So none of us are going to be getting anything close to what we asked for next week, which again is very frustrating. And we may be in the position to cancel appointments we've already made and that kind of stuff, which is beyond frustrating.
Because Sue said they have the capacity to give more injections. And so we've been passing that information on to the DHS that we've got capacity to give more vaccines if they can just get them. So,
Exactly.
but this
Exactly.
number is pretty telling.
Yep. I'll talk a little bit real quick about schools. This research article just came out day before yesterday from the CDC MMWR. This was a study that was done in Southwood County. Dr. Amy Falk and her team did this study in collaboration with the health department and 17 schools in Southwood County. The study I thought was very well done, and it showed, we talked about this last month. I showed you the masking compliance from this specific study was about 92% in our Southwood County schools. And during the time of the study, which was late August through November, there were 191 cases of COVID identified among students and staff members, but only 7 of those could be shown to have in-school spread. So the study reinforces the fact that as long as students and teachers are masked and following guidelines and precautions, the spread within schools is extremely, extremely low. So we're hoping to use this study to move more and more back into in-person school. In fact, this is launching another research study that we're working on preparing for now, where we would do baseline surveillance testing in Rapids and Nakusa schools for a couple of weeks, with their classes the way they are now, some virtual, in-person cohorting, to try to find kind of what is the lay of the land, what is the baseline for COVID in those schools. Then they would bring all of the students back full-time, either 4 or 5 days a week. We would continue that surveillance testing to see what kind of impact that has on COVID within the schools. And at the same time, we would relax some of the quarantine guidelines. So if there is a classroom-based exposure where everyone was properly masked, they would not need to quarantine if there was a positive case in that classroom. So we're working on drawing up that research study now, working on trying to get access to test kits and things like that. So we're trying really, really hard to get kids back in school. We know not having kids in school is having horrible outcomes for students, and there are mental health issues and hunger issues and child abuse and neglect. So we're working super hard on that. All right, I'm
Good.
stop sharing. So we have another full school planning meeting coming up on February 9th with all of the school districts. We're going to start planning for when we can do vaccinations in the schools, get some numbers together, get some plans together. So when schools are approved and we have vaccine, we can hit the road running. So those meetings are underway, and our next one is on February 9th. And the last thing I want to mention is I had a virtual meeting today with ND Paper in Buren. They are interested in allowing us to use some of their space to do community-based clinics. So right now we're at the hangar in Rapids. We know when the golf course is open, like Sand Valley, that hangar is going to be needed for planes. And come spring, we're going to have to move our way out of there. So Kathy and I are going to be visiting ND Paper next week on Thursday to kind of walk around and see what they have. There's an old bank across the street that they own, across the street from the mill, and we could potentially do drive-through clinics there. So we're going to be checking that out next week. Anybody have any COVID questions or anything at all? I feel like I need a drink of water.
Yeah, so this is John.
Shot.
Just take you back to the vaccine. Have you heard of any side effects yet?
There are side effects. People are having side effects. We've not had any severe allergic reactions or anything like that. Kathy and I probably aren't the best ones to ask because we both had pretty bad reactions to the vaccine. Kathy and I both got it last Thursday, and I could not work Friday morning. I can usually work when I'm sick, but I could not work Friday morning. I had so many migraine headache, fever, chills, body aches. I felt just like I did when I actually had COVID, but it didn't last long. So it went away pretty quick. And I think Kathy too went away pretty quick. What we're hearing mostly is pain at the injection site, a slight headache, some body aches, but very brief.
Okay, thank you.
Mm-hmm.
Any other questions? Thank you, Sue. Appreciate your thoroughness. So as far as legislative updates, let me just tell you what happened in the State Assembly this afternoon. In the State Assembly, we passed AB 4, which allows pharmacy technicians and pharmacy students to administer the COVID vaccine, and we amended that bill to also allow them to give epinephrine and Benadryl should they have somebody that has an allergic reaction in their pharmacy to the COVID vaccine. So that bill passed. There was only one person that voted against that bill, and that person is a person that doesn't believe in getting any vaccines. And so that individual voted against it just out of principle. So he was not going to vote for a bill, but that had bipartisan support and passed overwhelmingly in the State Assembly. We also passed AB 5, which is a bill that would allow DHS to administer the vaccine to 60-year-olds and older, because 60-year-olds and older comprise 94 or 96% of the deaths and a lot of hospitalizations. So there is a desire to get as many seniors vaccinated. It would also allow people to move from one group to the other without totally vaccinating everyone in 1A. So if they had vaccine and they had vaccinated everybody in phase 1A, they could move to phase 1B without waiting for permission from DHS. Right now, you're not supposed to move from one group to the next without having, without their permission. And so we felt that that was especially important in rural communities to get as many people vaccinated as they could. Another tenet of AB5 was to give campus-wide vaccination. Right now, if Walgreens or CVS goes onto a retirement community campus, they have to vaccinate everybody in 1A before they move to anybody in 1B, which necessitates them having to go back to the campus a second time. And so to increase efficiency, just vaccinate as many people as you can when you're there. And so we try to increase efficiency. Sue alluded to the DHS website. There's currently negotiations with Microsoft for a $20 million contract for website, and people just think that's an astronomical number to work with Microsoft to get them to help. So there were some website requirements in there and encouraging DHS to be as cost efficient as possible. There's a request in there to have DHS provide a plan to the state legislature by the end of February for mass immunizations. They don't really have a plan to mass immunize after they get through their phases. And then there's a lot of complaints that it's taking too long for the vaccinator applications to be approved at DHS. And so there's a requirement in there that they have to take action within 10 days of receiving a vaccinator application. Both of those bills passed the state assembly and will move on to the Senate. And so the Senate will deal with those when they get around to it. And then they'll go to the governor for possible signature. So I thought they were a step in the right direction and have some good things in it. Shows that the legislature is trying to work with DHS to get as many needles in arms as we possibly can in this period of time. So that's my legislative update from Madison, hot off the press today, okay? Any other legislative issue updates that anybody might have?
I have something, Donna.
Yep, please.
This is Rock, and this is as I'm multitasking, going through my emails. Senate Bill 23 was introduced today, sponsored by Senator Jock, and one of the co-sponsors was Representative Rosar. And it is a bill to give state veterans benefits to the Laotians who served in support of the United States during the Vietnam War. And I know I've talked to Lee on this, and it's important to that community here in central Wisconsin. So hopefully it will go forward.
Any questions? Anybody have any questions about that bill? Okay, great. Our next meeting is February the 25th. We will remain virtual for this meeting and see how things go in the next couple of months. The room where Bill is sitting will remain open. And Ruben, thank you for your technical expertise. You just didn't know that you were going to be an IT expert when you took this new position as the maintenance supervisor, whatever your position is now. So thank you for being willing to do that. I appreciate it. What would you say, Bill?
Oh, no, he said that. You're welcome.
Oh, you said you're welcome. Very good. Okay. Well, it is now 5:48, and if there is no other business that properly needs to come before this committee, I will declare this meeting adjourned. Everybody have a wonderful evening, and thank you for joining us.
Thank you.
Bye.
Thank you.
Thank you. Bye.
Thank you.